Yes, thank you, Chair. First of all, I would like to thank Baroness Ashton for her introduction, and both my colleagues, Mrs. Kolarska and Michael Cashman, for their words, and I wholeheartedly subscribe to what has been said before. I have to say, one of the last words that Michael Cashman just said, that this is a preventable disease. And that is actually what gets me very, very frustrated. That with very simple means and for free, it doesn't cost a penny, we could prevent so many cases of HIV/AIDS. We could prevent so much misery. If I look at a couple of keywords, stigma. I think Mrs. Kolarska mentioned discrimination, and it was also mentioned by you, Mrs. Ashton. And even within the European Union, there is still stigma. If you look at the fact that within a number of member states, for example, homosexual people are still not allowed to donate blood, that there are still member states who, against all rules and all the principles that we stand for, ask people for an HIV negative declaration before they allow them to enter the country, even within the European Union. Those are the things that we should address when we're also telling other countries in the world how to behave better. So if we welcome the lifting of the travel ban in the US, we should apply the same principles within the European Union. In addition to stigma, there is another problem, and that is narrow-mindedness when it comes to sexual morals, if you want. I'm always shocked to find that there are still people in this House who feel that they cannot endorse the kind of resolution that we will be voting tomorrow because it makes reference to sexual and reproductive health rights and sexual autonomy for women. If we would simply recognise those principles, those notions, if we would have the support of all the members in this House, then we could already eliminate so much misery. And I fail to understand how people can refuse to endorse these principles and still look people in the eye who are suffering, mainly women, many women I have to say, who are suffering from these debilitating diseases. I think that is something that they have to come clean with, I have to say. Autonomy and rights for women. Recognise the fact that women are in charge of their own bodies, that they decide. And not only outside the European Union, but also inside the European Union. These are all things that do not cost a penny, Chair, not a penny. Access to medication and to adequate health services. I mean, it is basic. Within the European Union, we find that a basic human right. That's also the theme of today's debate. Then why is it that we deny that right to other people, or we consider it a privilege or a favour? No, it is a fundamental right. And in addition, if you're practical, we're in the midst of an economic crisis which hits countries outside the European Union particularly. Well, a healthy labour force is the first precondition for economic development. Let's face it, let's invest in health. And therefore I would like to appeal to those countries who are currently considering cuts in the budgets for development assistance, and in particular assistance to public health. That should be one of our priorities, and we should not be talking about budget cuts, we should be talking about support to those countries, not forgetting at the same time to appeal to the responsibility of the national governments. In conclusion, Chair, I would urge all members of all groups across this House to endorse the resolution tomorrow. Thank you.